time to get a visit with our good friend Dr. Joe Congeni from Sports Medicine Center, Akron Children's Hospital. And Joe, you want to go into the kneecap?
Yeah. Can we go into the knee and kneecap?
Sure.
Yeah, of all of our knee injuries, 2/3 to 3/4 of what comes to see us is more kneecap than knee joint itself. So we see a lot more kneecap injuries. And, because it even though it's so common, it gets pushed in the background. I don't think you and I have talked about this in several years. We talked about a lot of dislocations, dislocated finger, Tyrod Taylor, dislocated shoulder, Kevin Love, and many, many others. But one of the most common dislocations is that of the kneecap.
What's the recovery?
So here's the deal. It's probably the most common injury, especially below age 16. So when kids get a plant twist pop injury, everybody says ACL. But more common than ACL with swelling in the knee with a twisting injury is going to be the kneecap, the patella, slips out of its little groove. And it's in just a little tiny groove in the femur bone, the upper leg bone, and it's pretty easy for the kneecap to pop out of place. And there's ligaments on either side of it that are supposed to hold it in place, and they get stretched or even torn. If it swells a lot, it means they're torn. And the biggest mistake that young athletes make for years is they go back to play too soon. So they try to go back to play when those ligaments still haven't healed, and what do you think they do? They tear them again.
Yeah.
And they tear them again, and they get so loose that by the time they come to see us in the old days, we used to have to send them to a surgeon to tighten it up and do surgery. Now we're so much better with picking them up early, rehabilitation and physical therapy to strengthen them, better bracing and things to hold that kneecap in the groove, that surgery to tighten up the kneecap is done a lot less frequently. And the fact is that very, very many kids treated with a short course of relative rest, but especially aggressive physical therapy, do very well, never have a problem again, never have to go to surgery. Yeah, so patellar dislocation is something that is just, in an office like ours, less than 16 years of age, so very, very common, and I wanted to make sure to touch on it today.
Years ago when we would hear about a kneecap dislocation, it was almost like a death knell in the medical field, but that's astounding to me. So let me ask you this. With a dislocation of the kneecap, is that a direct blow on the kneecap right and left? What are some of the causes?
You know that it is unique that it's kind of both ways. So sometimes, like ACLs, they don't get hit by anybody. They just twist their knee and the kneecap pops out. But this is one, unlike the ACL, that a lot of times it is a blow to the kneecap, particularly on the inside, and the kneecap pops out to the outside. And yeah, in our day it was, because what would happen, it would pop out a second, a fifth, a sixth time. And so what would happen, people would say, I have a trick knee, and it would pop all the time, and they couldn't even run very far or play very long without it popping out. And doing the surgery was, again, when you're in the field a long time like I have, early in my career, many of my patients needed surgery. Now it's really not very frequent, maybe every couple of months, that we have one that's so bad and so old that it needs to be operated on.
If someone gets a dislocated kneecap, let's say in the fall soccer season or football, you said relatively quick recovery time, hard rehab. Are they back at the end of the season, or is it next year?
No, it's 3 to 6 weeks.
That's
they do,
it.
Yeah, really, really well.
Wow.
3 to 6 weeks of getting back. Again, I don't want, and so many people rely only on a brace, and I see them in the muscle shrinks. You got to be doing the strengthening part, but bracing's better too. Those really bad looking old, big, heavy, bulky braces. Well, we improve technology all the time, and the bracing is better too. And so kids can play pretty well with the brace. They don't mind. And in 3-4 weeks, when they're strong enough and that kneecap's tightening up and we feel good about the brace, we get them back into play. So no, they don't miss a whole season. You're right, soccer and basketball really are right up there with football and others, if not even more so in soccer.
Speaking of braces on knees, kind of staying down that same road, I'm noticing more and more, especially in the last 3 to 5 years, high school, college, and pros on up, the offensive linemen all wearing a knee brace.
Yep.
And for many years, you would only see the offensive linemen who were recovering from a knee injury wearing those braces. Now you're almost seeing it as part of their uniform. Obviously, preventative measures. Talk about that.
Absolutely preventative, very observant by you. You see it at the pro level, so then the college level, so then the high school level. So almost everywhere I go, the interior linemen. Okay, so the backs and wide receivers do not want to wear these hinged braces. But the injury that we're preventing the most, maybe some ACLs, but definitely the old MCL that used to be so common in football. You're engaged with one person blocking them, and you get hit on the side from somebody else, and it puts all the pressure on the outside of the knee, so the big thick ligament on the inside of the knee, the MCL, would tear so frequently in football, especially in those guys engaged in the box, those 8 or 10 guys in the box. Nowadays, many of those guys wear. The key to that is a well-fitted brace. The early studies in the 90s and 2000 were being done. Kids would just be given a brace. Nobody fitted them to see whether it worked or not, and it would slide down. It would be up too high, and there was a couple of studies that said it could cause more problem than it helped. Nowadays, that they're easily fitted, well fitted by certified athletic trainers and brace specialists. Using preventative braces have helped us greatly to reduce MCLs and maybe ACLs a little bit too.
All right, there you go. Joe, great stuff this morning. Thanks for coming in. We'll hook back up with you next week.
See you next week.
We'll talk about another Browns win.
I think so, Ray. I think you're right.
You and I were talking about it too. Boy, relatively injury-free.
Oh, my gosh.
Going medical. So I know we got the broken forearm for the one guy, but really that's been it.
I mean, in football, you could be going down in droves. You could be 5, 6 guys, and usually for us, that is the course we go down. And so to be at this point in the season, we got to be optimistic about something. We bounced right back off the canvas from Monday with the Indians. Yeah. We're fired up about the Browns.
I like it. See you, Joe.
Thanks, Ray.
Dr. Joe Congeni, Sports Medicine Center, Akron Children's Hospital.